MMR-VAERS. And the question of vaccine safety signals, hello. I am Dr. K. Paul Stoller. Now, for decades, the MMR vaccine has been described as one of the safest and most effective public health interventions in modern medicine. But it was known there was 10% primary vaccine failure rates and up to another 15% in secondary failure rates. In other words, the vaccine wore off, so it is impossible to eliminate the disease with the current vaccine. Measles once killed a few hundred of Americans annually. Today, measles deaths in the United States are rare, but a recent analysis has reignited debate. Researchers examined reports in the Federal Vaccine Adverse Event Reporting System, known as VAERS, focusing on deaths reported after MMR or MRV vaccination. What they found has raised questions. What is VAERS? Before we go further, it's critical to understand what VAERS is and what it isn't. VAERS is a passive reporting database, open to the public, designed to detect possible safety signals. It is reported that only 1% of adverse reactions get reported to VAERS. The analysis identified several hundred U.S. reports of death following MMR or MMR-V vaccination over multiple decades. Many reports involved children under 2 years of age, deaths occurring within 2 weeks of vaccination, classifications including SIDS, seizures, and cardiac arrest. The researchers argue that the clustering by age and timing suggests a signal that deserves further investigation. The analysis compares VAERS death reports to CDC-confirmed measles deaths since 1995. But that comparison has limitations. There is no legitimate safety surveillance of this or any other vaccine on the schedule. No transparency, no safety trials, let alone rigorous ones. No independent evaluations, no formal investigation using active surveillance systems, autopsy review, medical record linkage, or cohort-based background rate comparison. Public confidence depends on openness. Measles itself is trivial if there is adequate nutrition. Symptoms are mild with proper vitamin A intake. Before widespread vaccination, several hundred deaths from measles each year in the USA. Vaccination dramatically reduced that number, but public health credibility requires two things: clear communication of benefits, honest investigation of safety concerns, not dismissal, not exaggeration. Final thought: for decades, the answer to infectious diseases in children has been vaccines, more and more vaccines with no safety testing. Getting measles clearly has risks for a few hundred children if the vaccine disappeared, but for the millions of others, they would obtain lifelong immunity, which, as previously stated, is not something the vaccine can do even with boosters. It is just not responsible to sell this vaccine with alarmism when there is a treatment that can help prevent and treat the symptoms: vitamin A. We need to make public health decisions based on rigorous, transparent science, not the marketing agendas of pharma. Because when it comes to children's health, certainty must be earned, not assumed.